This is part two of patient-centered cross-cultural interviewing. So as you've seen or read in Dr. Kleiman's article, there is a way that clinicians can find out the patient's understanding of their own health and their own illness. This understanding or model has three basic components. The first is a description. It's the patient's description of what the disease is like for them. The second part is the concept or conceptual understanding. It includes the causeness of the illness as they see it, what they think the appropriate treatment is, the potential outcome that they would get from the treatment or from the disease, as well as what logic there is that is the basis of this disease concept. The last part is personal understanding. The patient might have a personal level of understanding of the disease, and this personal level may not fit neatly into the cultural explanation that they were raised with. So let me give you an example of a type of explanatory model for a patient. So let's say that a patient believes that the chronic pain in his back is caused by sleeping with the window open, which allows a draft of cold air to come in and seep into his back. And then he feels that the treatment should be something that's rubbed into his back and that it will go back to normal. And therefore, he believes that the draft is a physical thing, and the treatment then to therefore be physical. So that's an idea of a model. I'm not saying everybody has that, but that's when you get the explanation from the patient and you put it together. That's what that would be like for that man. The thing is that people have beliefs that do not necessarily match those of medicine, and therefore they might be reluctant to disclose it. So our job as clinicians are to provide openings for patients to feel comfortable telling us about their explanatory model. So we're now going to look at some questions that will help you obtain the explanatory model. And these questions were formulated by John Coulihan and Miriam Block, and they're based on Kleinman's model, Kleinman's work. So there are 9 questions in this explanatory model. The first are descriptive, and there are 2 of those. First descriptive question is, how would you describe the problem that's brought you here? The second one is, what are the main difficulties that this problem, sickness, illness, disease, or misfortune has caused you? Obviously, you don't say all of those, but if you use the word problem, it's kind of open and allows the patient to tell you how they're seeing it. They may not see it as a sickness. They may see it as some kind of misfortune. So that kind of begins to tell you what the concept is. They may not even see it as a medical problem. You might be seeing it as more serious than they do. So let me give you an example of how the guy with the back might have answered it. I have this pain in my lower back. It's a dull pain, though when it's worse, it gets sharp. It's worse when I get up from sleeping in the morning. And the main thing that it does, or it's caused me, is that I have to move slowly, not to aggravate it. I can't get dressed or move around as fast as I used to when I get up. But then after a while, it gets better. The second part is the conceptual model, the conceptual part, and there are 5 questions here. What does the illness do to you? How does it work? So this is a little different than the previous question, which was just describing the difficulties that it causes. This one is really, functionally what happens for you. Why do you think it started when it did? What kind of treatment do you think you need? What are the results that you hope for? What would happen if you don't get treatment? And who else can help you get better? What can they do to help? What can they help? So let's go back to this example. So the person says, my problem has me waking up earlier to be on time. It started from me leaving the window cracked at night when I sleep. It got worse over several nights. Since then, I started sleeping with the windows closed, and the pain is not as bad, but it's still there. I need you to give me something to rub on it. The cold draft seeped into my back, and I need some kind of medicine that will rub it away so I can get back to normal. I guess my wife will have to help. She'll have to do the rubbing since I can't reach back there. So it can be as simple as that, and then it can be a lot more complex depending on the patient and the issue, and also their explanation. Now, the final two questions are the more personal questions, and the first question is, why did you in particular get sick? And the second one is, what's most frightening about your sickness? So his answer could be, as I said earlier, I left the window open. This is because I've been working so hard over the past few days. My body has been hot when I go to bed, so I cracked the window. And even though I knew better, I was raised told not to open the window because it'll cause you to get back pain with the draft. I want to get rid of this. I can't stand the thought of having to live with this forever. So now you have an idea of a patient's explanatory model. He thinks he got sick in particular because he was working so hard that his body just maintained heat, and that he did something that he shouldn't have done, which is he knew he shouldn't sleep with the window cracked, and he did. And so that's his whole explanation, and you can see there's some logic to it. It may not be the same logic that you and I, or that you will have when you leave the PA program, but there is logic to it, and the patient has an explanation. And you can work with that as you work to try to work with the patient in getting better. So just to summarize, we talked about barriers to cross-cultural communication. Those barriers include time, language, trust, verbal, nonverbal communications, and that we want to pay attention to those barriers so we can try to alleviate or even avoid them. And that there are questions that you can do to elicit the patient's explanatory model. And that those questions provide an avenue for the patient to tell you what they think, sometimes what they've done, because a lot of times have treated stuff on their own before they came to you. And so those 9 questions, and obviously it's difficult. You don't necessarily have time to ask all 9 questions at each encounter. If it's in a primary care or a continuing basis, you can get the questions over time. You can pick 1 or 2 of the questions that kind of help you understand. Some about the conception, some about the description. You can work this into your regular medical history taking. But as you can see, that other guy with the back pain was not necessarily from another culture. He could have been born and raised in the United States. I know people who were raised thinking about these drafts in your back causing pain. So it's not far-fetched. It's something that you should consider doing for every patient, and not waiting to the patient who comes with a new language who's come from another country. Every person has an explanatory model for their illness. Now I want you to think about the last time you were sick and then try to answer these questions for yourself. This is actually one of your assignments for this week. Thank you.